say no. We cannot afford to say we have other priorities that are more important, because this is important, particularly when it comes to the priorities of healthcare, the incidence of tobacco and alcohol abuse, and the importance of tax reforms is something that I'm very passionate about. I just believe tax them, tax them, tax them. If they want to drink, tax them. If they want to use alcohol, tax them. Tax them, tax them. Why? Because the burden on our healthcare system is very heavy. It's what we don't speak about.
Yes.
I was fortunate to work at Katwa Hospital. I've worked at Windhoek Central, I've worked at Onanjokwa, I've worked at Oshakati Hospital. I've worked at both mental health units, Oshakati as well as the one here in Windhoek. So I've been everywhere. And then I've also worked in various district hospitals. But I want to say something very boldly. I would like to say, these are not proven statistics, no, but I would like to say that a majority of cases that I dealt with when I was practicing were in some way or other related to alcohol and tobacco. That's the truth.
Yes.
Right? So if you deal with chronic illnesses and you're talking about liver disease, chronic liver disease, and we saw a lot of it at Onanjokwa Hospital, a lot of it. A lot of the patients that were coming in were due to, and mind you, a lot of the times we talk about alcohol, we only think it's the formal things that you put in the shops. There's also the other things that we don't speak about, right? In the villages where that's all they have, they drink themselves, they come to the hospital, they have ascites, I treat them therapeutically, they go back, they come back after a few months, and it's a repeated cycle. And then the other things such as the abuse, oftentimes has a substance component to it. A lot of the times when we sit there, the interns at Katwa Hospital will tell you the worst time to be there is on a Friday at the end of the month. Why? Because people drink, and then they come. And mind you, we only talk about the violence that happens outside. Nobody talks about the violence that happens at the hospital, where healthcare workers even sometimes feel their safety is threatened. These are things that are happening every day, where people come and they stab someone and they want to continue the fight at the hospital. These are things that are happening on a day-to-day basis. So that's why I say, if they want to drink, you tax them.